Washington, D.C. is among several parts of the nation experiencing an uptick in COVID cases. Over the past 2 weeks, cases are up in 27 states, largely driven by the B.8.2 variant. Today, the White House's new coronavirus response coordinator addressed several of the concerns surrounding the increase.
We are seeing case numbers rise in New England, here in the Mid-Atlantic. We're going to see this, right? In the pandemic, we're going to see moments where cases go up, cases go down.
Dr. Ashish Jha says overall, the 7-day average is still one of the lowest since mid-July. But he acknowledges there are many cases now going uncounted due to home testing.
I'm a huge fan of home tests. You know that. I've been saying that for 2 years. I continue to be. I think it's great that people have testing at home. One of the costs of that is we're not always able to identify how many people are getting infected. This is why it's really important to also look at hospitalizations, right? Because if we're seeing a huge spike in cases, if we were to see a huge spike in cases, we'd also see that eventually trickle into hospitalizations. We're not seeing that. Hospitalizations right now at the lowest level since March of 2020. That's good news.
Jha says the CDC director will decide later this week whether or not to extend the federal transportation mask mandate, which still requires masks on planes and trains. It's set to expire on the 18th.
I think these decisions should always be, guided by science and evidence and a framework, a scientific framework that helps us make smart decisions about these. That's why we have the CDC scientists working on that right now, and we're going to see what they come up with. And based on that, I think we're going to want to make a decision based on kind of the facts on the ground and the science and the scientific framework that we have.
Dr. Jha says he is not overly concerned yet about the rise in cases, but stressed we do need to watch the levels closely and, of course, be careful. Coming up at 6, we're going to take a look at who Jha says should definitely be getting a second booster and who he called just as soon as the FDA decision on those boosters was made.